not letting me do that.
Okay, we're recording now.
Thank you. Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers. I'm going to be your facilitator for today's session. Today we're going to be talking about mental health, and then that is in I'll give you a little background. Not sure what's happening, but got it. We're going to be talking about mental health, and let me introduce Lucy and Elliot to you. Dr. Elliot Montgomery Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and also virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Now let me tell you a little bit about Lucy Barylak. She received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term care manager of the Caregiver Support Center at the Respite Program for Family Caregivers. There, she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. In 2003 and also in 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, awarded for her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. Lucy also co-edited a book for healthcare professionals entitled Responding Creatively to the Needs of Caregivers. She's been a key architect of screening and assessment tools of family caregivers, for which she provides training to healthcare professionals across North America. Lucy also consults for private industry, including the WellMed Charitable Foundation and clinics in Texas. Additionally, Lucy is a liaison supervisor at the School of Social Work at McGill University, where she currently supervises 20 interns. She'd also like you to know that she cared for her mother for about 10 years. Lucy and Elliot, welcome to the session today.
Thank you. Thank you so much, Glenda. Welcome, everybody. So happy to have you with us. So yes, we're talking about mental health. You know, mental health and physical health are connected. So this program will explore ways to deal with the emotions that come with caregiving, how to address addiction, and how to handle the challenges of interpersonal conflict while being a caregiver. So there's an estimated 44 million Americans aged 18 and older provide unpaid assistance and support to older people and adults with disabilities who live in the community. The value of this unpaid labor force is estimated to be at least $306 billion annually, nearly double the combined cost of home health care, which is $43 billion, and nursing home, which is $115 billion. Evidence shows that most caregivers are ill-prepared for their role and provide care with little or no support. Yet more than 1/3 of caregivers continue to provide intensive care to others while suffering from poor health themselves. A substantial body of research shows that family members who provide care to individuals with chronic or disabling conditions are themselves at risk. Both emotionally, mentally, physical health problems arise from complex caregiving situations and the strain of caring for a frail or disabled relative. So, you know, studies consistently report higher levels of depression, symptoms, and mental health problems among caregivers than among their non-caregiving peers. Estimates show that between 40 to 70% of caregivers have clinically significant symptoms of depression, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for a major depression, and that's really quite high. Both caregiver depression and perceived burden increases as the care receiver's functional status declines. Thus, higher levels of clinical depression are attributed to people caring for individuals with dementia. Studies show that 30 to 40% of dementia caregivers suffer from depression and emotional stress. Depression and anxiety disorders found in caregivers persist and can even worsen after the placement of a patient in a nursing home. Many caregivers who institutionalize their relatives report depressive symptoms and anxiety to be as high as it was when care was in the home. That's really quite surprising, but that was very interesting to note. You know, depressed caregivers are more likely to have coexisting anxiety disorders, as well as substance abuse or dependence and chronic disease. Depression is also one of the most common conditions that are associated with suicide attempts.
And this is such an important thing that we're talking about. We don't talk enough about suicide and seniors. Suicide is something that has a lot of stigma in our society, and it is very much linked to depression and to mental health, obviously. According to the Institute on Mental Health, suicide was the 10th leading cause of death in the United States in 2019, ahead of the pandemic. Older adults in particular face a significant suicide concern. According to the National Council on Aging, while older adults make up just 12% of the population, they make up about 18% of suicides. And men 65 and older face the highest suicide risk, highest suicide rate rather, among all populations, which is very interesting. Rare that we think of white men as being a high risk group for certain things, but when it comes to suicide, that is certainly the case. So let's look at why. And studies and clinicians are continuing to try to assess this because suicidal behavior is common in older adults for several different reasons. Loneliness has been found to be at the top of the list, and we know that isolation and loneliness certainly have an impact on mental health. Some older seniors are homebound and live on their own. And if their spouse, as an example, has recently passed, or if there are no family members nearby, they may lack social connections that they need to be able to cope and to function. Other reasons for suicidal intent in older adults include grief. Grief can be very profound in the feeling of loss. Adults who live long enough begin to lose cherished family members, friends, and this continued pattern of losing people in your life can be very difficult for some people. I talk about my cousin who's 92 that I'm very close with, and she has a very good sense of humor, fortunately, because she laughs all the time and tells me that all of her friends have passed away and how lonely that is for her. But it is true, and it's something that I'm sensitive to, and why I call her every day and want to make sure that she's engaged in some way. And this is something that unfortunately just comes with the life course. But some older adults who lose others around them may be wrestling with their own mortality and experience anxiety about dying. For some, what we used to call the golden years are a time of loss. Some people actually call it an age of loss, and that can feel overwhelming and can intensify feelings of loneliness, hopelessness, and certainly depression. Many older adults also experience chronic illness and pain and are more likely to face illnesses like arthritis and heart problems, high blood pressure, diabetes. This can impact quality of life, and so seniors who experience things like loss of vision or hearing or senses, it impacts your ability to do the things that you love doing and that bring quality to your life. And so it's all of these things combined together to increase potential risk. There was also a study that came out about 2 years ago in which researchers found that older adults with cognitive impairment and dementia had a higher risk for suicide. And declines in cognitive function can make decision-making activities more challenging and can also increase impulsivity, which of course links with suicide. The most recent data on this was actually published just in October of last year, looking at suicide risk of caregivers of people with dementia. And because there's limited evidence available on the prevalence of suicidal ideation, suicidal attempts and suicide rates among this population, this research examined the findings of 194 studies that came before it and included a really large population of over 1,200 informal caregivers of people with dementia who were an average age of about 63.9. 74% of them were females. And the prevalence of suicidal ideation varied tremendously, between 4% to as high as 78%. One study reported that 1 in 17 caregivers of patients with dementia died by suicide. So the conclusion here is that the prevalence of suicide ideation is high, and it affects certainly people with chronic illness, but also caregivers of patients with dementia. These findings suggest that we need more interventions. We need more attention paid to this matter. In fact, many seniors who go to a primary care physician who do wind up attempting suicide have been seen by a doctor within the past 30 days. So that's alarming. If you are a healthcare worker, or if you're simply participating today, share this information with others. Pay more attention to the affect of caregivers around you. It can be very difficult, but experts really say, and I would agree with this, that if you have concerns about someone, you should ask direct questions. Things like, are you thinking about suicide? Or how can I help? Be supportive and be unbiased if you can. Be sure to listen carefully to people's answers and to try to acknowledge their emotional pain. Help the person stay focused on all the reasons why they would want to keep living. And keep them safe. Find out if they have already made any attempts on their life, if they have a specific plan or timing in mind. It's a very good technique actually to ask people what their plans are for the rest of the day, if they have plans for the weekend. Typically, if people have future plans, they may not be in immediate suicidal risk, but that can depend on the person as well. So it's very important to learn about what the person is going through and to try to assess if there is immediate danger. If you're not sure, call 988. 988 is a new suicide and crisis hotline that was launched, I believe, last year. And it really can be an invaluable resource for helping you connect with professionals if you're experiencing crisis, but also to learn information about how you can help others. So I really encourage, again, and we'll provide these resources at the end of our program, but help people connect. If you have a senior in your life that you think is at risk or is in crisis, get them connected to healthcare, to professional networks if necessary, but also social support. Friends, family, get people to check in on them. This is very, very important. A lot of studies have shown that following up and keeping in touch with people can reduce suicide-related deaths in high-risk populations, like the ones we've been talking about. So if you've had an initial conversation with someone, like asking them if they've thought about suicide, follow up with them, text them, send them a message. If there's anything you can do, it's very important to keep connected. And again, that 988 crisis intervention line is available 24 hours a day, 7 days a week.
You know, that's it's a wake-up call, and I think it's really very important to keep your eyes and ears open if you are a caregiver, especially if you are working in the healthcare field, to be aware of that. So I really want to talk about the whole idea that we know that caregiving can be very rewarding for many reasons. And I have to share that in my own personal caregiving journey, it was very rewarding. But we also know that caregivers experience a lot of difficult emotions in the process of providing care. Many caregivers feel frustrated, overwhelmed, angry, sad, and resentful. These feelings can have a serious impact on your physical and mental health, especially if you have no outlet for these feelings. As a family caregiver, the focus often is on everyone around you, especially the person you are caring for. Most caregivers have numerous duties, from cooking meals to handling doctor's appointments, administrating medications many times, helping with bathing, dressing, and eating, and many, many more. Housekeeping, shopping. This level of responsibility can cause extreme stress. When left unmanaged, stress can lead to anxiety, and we know that. A condition categorized by persistent and excessive worrying. So if you're constantly worrying, you have there's a high chance that you will become very anxious. Other symptoms of anxiety may include irritability, sleep problems, and trouble concentrating. These symptoms can make it difficult for you to fulfill your caregiving duties, which can then increase your anxiety over time, and this can lead to feelings of isolation and disconnection from others. So it's like a vicious circle. It's so important to acknowledge your feelings. Elliot and I keep saying it in every session that we do. Don't ignore how you feel. It's the first step, really, to acknowledging that you need some help. So having anxiety and large stresses in your life can make you more vulnerable to suffering from depression and vice versa. Depression can make you more vulnerable to suffering from anxiety, exactly what I was saying. When it comes to drinking alcohol or using other substances, unfortunately, some people may feel that these behaviors are their only outlet for the stress, their anger, their sadness. Feeling of isolation or disconnection are often at the root of addiction. Where a person uses substance often to escape the difficulties and the pain of their realities, some people use substance to self-medicate their symptoms of depression or anxiety. And I have to say that in the short term, people might find that it, quote, works, meaning it dulls their symptoms for a very short period of time. However, long-term use of substances can actually increase anxiety and depression symptoms and ultimately make these conditions much worse. So it might help you in the beginning, but as you become, using it more often, it really has the other side effect. This is why substance use is considered harmful coping mechanism. There exists specifically a lot of research on ways in which long-term care use of alcohol is related to increased depressive symptoms. And when we talk about depression, I mean, it could be if you're diagnosed with severe depression, you really cannot function very well on a daily basis. And if you're a caregiver, you have to think about how you're actually going to be managing, not only taking care of yourself, but also taking care of someone else. So again, if you're feeling these feelings, please get help. You don't have to do this alone. You know that stressful caregiving situation may lead to harmful behaviors. So I want to talk a little bit about that. As a response to increased stress, caregivers are shown to have increased, as I said, alcohol and other substance use. Several studies have shown that caregivers use prescription and psychotropic drugs more than non-caregivers. And not only prescription drugs, but even probably over-the-counter drugs as well. Family caregivers are at a greater risk for higher levels of hostility than non-caregivers. Spousal caregivers who are at risk of clinical depression and are caring for a spouse with significant cognitive impairment and other physical care needs are more likely to engage in harmful behavior towards their loved one, which is, that we really have to look at that. It's something that is out there in research, but it's also out there in practice. We recognize that if caregivers are at that point, they can be harmful to the person that they're caring for. and something that we really need to explore and look at.
So before we continue on, I thought it might be a good time to see if anyone has any questions or any comments about anything we've shared to this point.
You can simply unmute your microphone and we'll be able to hear you. The chat box does remain open if you're more comfortable putting something there.
And we certainly are sensitive to the topic today. And as I said, there is stigma around things like suicide, even just talking about mental health, which I believe is changing. But that's why we're so big on ensuring that people talk about their feelings. And that's really the focus here. Many health insurance programs now cover things like mental health counseling, substance abuse treatment, and many therapists, including those available with telehealth now. So you don't even have to leave your home. You don't need to get respite care. It's so important to check with your health insurance. And you can also talk with your healthcare provider to see if there's a mental health provider, perhaps in that practice, or if you have certain specific issues that you want to look at, for example, addiction or caregiver support, or even getting a psychiatrist for your loved one. These are all things that should be part of things that you're discussing with a healthcare provider. And you can also find information about support groups as well, which can be very helpful in your community by calling 211. The thing that I love about the 988 hotline that I was speaking of before, it's staffed by trained mental health counselors. It's completely free. It's completely anonymous. You can call from any phone, and it doesn't require that you have a lengthy follow-up or anything like that necessarily. So for some people, it can be a very good foray into sort of testing the waters of how counseling might benefit you or how you might feel about sharing what you're feeling. I really believe in this because our mental health is linked to our physical health and vice versa. There's that old saying, you know, if you don't have your health, you don't have anything. But it's not just your physical health, it's your mental health too. And a lot of how we learn to cope with life and stressors are things that we learned actually in childhood. And it's something that scientists now are actually linking to our genes. So think about how your parents dealt with mental health. Do you believe that there might be similarities in your own life experience? Are there differences? And I do see that we have a question here from Joanne. What is the difference in these hotlines and who funds these? Great question. So these are federally funded. The 988 hotline is something that was launched as a result of the pandemic because it was noted that there was an increase in mental health concerns during that time. And so 988 is a free line that is staffed, again, by licensed mental health counselors. It is federally supported and available anywhere in the US. 211 is a resource line. So that is the line that you can call in any community and find information that might be specific to where you might be living. For example, support groups, if there are any free mental health services in your area, as an example, 211 might be very helpful in that regard. So think of 988 more as a mental health or crisis line, whereas 211 is more like 411 where you call for information. So I hope that is helpful. In a previous program that Lucy and I had done some time back, I had shared that when I was growing up and I would notice that my mother would be angry, she would do one of two things. She would either write in her journal or she would bake. And it's no wonder that early in life, I learned that nothing could really quell my feelings, much like food. So I think many of us learned things like this similarly in our childhood. It might be why food was one of our sources of comfort during the pandemic for many people, because it was a very stressful time. And then, of course, many people felt that they had let themselves go during the pandemic by gaining weight. But in fact, we were actually doing the opposite. We were coping the best that we knew how at the time and trying to keep everything together. So as people, we're typically not very good at giving ourselves credit for getting through hard times. And instead, we get angry with ourselves for how we could have done things better. So it's very important to reflect upon the things that we observed growing up and to see what we're mirroring, what we're mimicking, what we might be doing differently, and to give ourselves a little bit of compassion and empathy. Because many people enter into caregiving circumstances not by choice. So it's very important that we practice a little bit of self-compassion. Does anyone have any questions or any other comments? If you do,
Well,
you can, oh, please go ahead.
No, I was just thinking that if there are any caregivers who are caring for someone with mental health issues, it's extremely difficult, because the person at that point, sometimes they don't want you to share. They don't want to share with you, or they don't allow the doctor. You can't just call up the doctor and say, so how did the session go, or what's happening, or things like that. And many caregivers have gotten in touch with me and saying, what can we do? And so what I really want to say, in many cases, there's not much you can do as long as the person is not at risk to themselves. And if they don't want to share, as long as they're not angry, as long as they're not being aggressive, both physically and mentally towards you. But you don't really have to do this alone. There are good support groups where you can share with other caregivers who are going through the same situation as you are, and recognizing that you're just not alone and doing the best that you can, because at the end of the day, there isn't much control that you have as long as you feel that it's still rewarding for you to continue caring for that individual. And I think especially you need to think about your own needs. I always say that caregiving is a balancing act. One doesn't outweigh the other, there are two people in this relationship. And so if you don't consider yourself, then all the things that we've been talking about can actually happen. So if you don't acknowledge your feelings and you're frustrated and you're angry and you don't deal with that, there's a good chance that you will be affected by your emotional feelings with your physical feelings. So just be aware of that and get the help that you need, as well as the person who has the mental health issues.
Yes, those are excellent points. I recall back in the spring, we had done a program specifically on caring for someone with mental health issues, which you can find actually on the WellMed Charitable Foundation website that Glenda mentioned earlier with the recording. And I recall vividly that we had a participant who had been bottling everything up and ultimately lashed out in anger at his care recipient. And he broke down during that program because he felt so badly about how things had gotten out of control. And so it is just so important that we remember that we need to care for our own mental health in the process. Absolutely.
And if you do lash out, recognize it. And as Elliot was saying before, don't, yes, it wasn't the right thing to do, but there might be reasons behind it. And the fact that you recognize it and feel bad about it and get the help that you need is really the first step in dealing with things like that.
Absolutely. And also recognizing again that there is a link between our mental and physical health. And I don't know what just happened. What happened? Hold on. All right, there we go. Sorry. Because as we were saying, mental and physical health are inextricably linked. For example, we know that anger causes an increase in blood pressure. So it's very important that we recognize these things. Something that continues to fascinate me is something that I have experienced myself, and it was actually the topic of a Journal of Alzheimer's Disease report publication from last fall. There was a systematic review of literature that examined associations of anger and hostility with caregiver health outcomes, exactly what we're talking about. And overall findings indicated that higher levels of anger and hostility exerted a negative effect on caregivers' physical health. So, higher anger control, meaning to hold and bottle your anger in, was associated with increased weight gain among caregivers. This is kind of what I was describing before about the pandemic weight gain, which many people attributed to stress, lack of control, and what else? Anger about not being in control of the situation or how the situation was being handled. But people were keeping it together during the process. It made me think of the old saying, it's not what you're eating, it's what's eating you. Now, the study also found that higher expressed anger predicted higher glucose dysregulation. Blood sugar varied more among people who expressed their anger. So caregivers, interestingly, caregivers who contained their anger gained weight, and those who expressed their anger had irregular blood sugar patterns. So it's just very interesting that both of these outcomes of anger link with insulin levels in the body. The perfect illustration of how our physical and our mental health are linked. And the study was the first of its kind to measure evidence demonstrating the harmful effects of anger and hostility on caregivers' health. And it really highlights the need for prevention, for programs like the one we're doing, for more support of caregivers that are experiencing high levels of anger. And it's a very common emotion that caregivers experience.
Well, I certainly can agree with you on that. As a caregiver for over 10 years, my emotions, it was like a roller coaster ride, even though I was very aware and knowledgeable about this particular issue. When you're a caregiver, you forget everything else in a way, your professional education kind of leaves your mind altogether. But I do feel very strongly that when we feel all these feelings, it's because there's a sense that we don't have control. So one of the things that I'm kind of repeating myself in this session especially is that when you acknowledge your feelings, it's a form of taking some control. Meaning, why am I angry? What's getting me so upset? Why am I so frustrated? And actually writing these things down, because for many reasons your feelings are, because it's justified. Now, what can I do about it? Why do I have to stay in this state? And so we talk about tips like Elliot's favorite tip, exercise. It's amazing what exercise actually does for your well-being. I'll let him talk a little bit about it in a few minutes. And just the joy of that, eating well, really taking care of yourself, getting enough sleep. Remember the balancing act? Don't forget that there's two people and two people need to be taken care of. So I'm going to let you talk a little bit about exercise, but as everyone knows who's been watching us, my favorite exercise in my apartment that actually started under the pandemic is dancing around my living room and listening to amazing music that kind of changes your outlook a little bit. You're getting your exercise, but there's also joy, and music is something that I go for just to relieve some of my frustrations.
Well, it changes your brain chemistry. And that's why I am such a big advocate of exercise, because it helps me manage my own stress, just the stress of day-to-day life. But if a crisis comes up or if something happens, I find that I'm drawn to exercise. So usually I'll take a walk or I'll go for a bike ride. But there is a lot of research to back up the fact that taking a walk or being out in nature can help to diffuse feelings of crisis, anxiety, depression, stress, anger, all of it. And the other thing that is so important for caregivers is when you're having a tough moment, take a pause, go to the restroom, take a minute by yourself. The same holds true in my mind for exercise. That's why I love just getting outside for a couple of minutes, because it can completely change your perspective. And Lucy, I wanted to ask you a question that comes from a caregiver that I'm close to. And I thought it was very topical for our program today, because we know that one of the greatest challenges for caregivers can be how to handle interpersonal conflict while being a caregiver. And I have a former colleague who's a caregiver to her mother who has advanced Alzheimer's disease. I'm going to just call her Melanie. And Melanie's mom lives with her husband, and their 8-year-old son, which is really amazing. And Melanie's mom, unfortunately, as her Alzheimer's has progressed, has begun to demonstrate aggressive behavior, biting, yelling. And Melanie's been very effective at redirecting this, just like we tell caregivers to do, but the behavior is increasing, and it's causing conflict between Melanie and her husband. Her husband feels that it's now time to place her mom in a long-term care facility, which was never the plan that they had agreed to when they agreed to have her mom live with them. But the change in her mother's behavior has caused him to be concerned about his son's mental health, seeing his grandmother lash out and bite their child's mother. So, Lucy, what advice would you have to offer someone in Melanie's situation?
Well, first I have to say this is certainly a difficult situation for both your colleague and her husband. But what's kind of right away, as you're telling me this, asking me this question, the most important person is their 8-year-old son at this point. That's the person that needs to be protected at all costs. Both from any anxiety over his grandmother's behavior, but also the possibility that the grandmother could hurt him physically. And when she lashes out, since she has cognitive impairment. So there's really nothing more to say that that's the priority that both your colleague and her husband need to sit down and really talk about. This child needs to be protected, because if someone else notices this kind of situation, a neighbor, another relative, they can call youth protection into this scene because this child is at risk. And so it is very difficult. And, when you said that promises were made, but there has to be a reality to that too. So first and foremost, they have to really make a plan. And I think they need to take the mother to see the doctor as soon as possible, because I don't know if this is something new. I guess it's sort of something new started. The mother may be suffering from some sort of a medical condition that they're not aware of that's causing this behavior. She could have a urinary tract infection. If she does have any other diseases, they could be progressing. Even the medication that she's on, if she's on any medication, there are times when you take a medication for a long time and then there is an adverse effect of some sort. So right away to the doctor. I think they need to also look to see for places. It's a time to start looking, and even having an emergency situation where they would either have to take the mother to a respite place or just be prepared. But first and foremost, and I think that by them identifying that it's the child that needs to be protected, they're going to be united in any decision that they make. And so that it's very important for your colleague to recognize this. And I'm sure she will. And I'm sure she probably does, or she wouldn't even have talked to you about that. So I'm just wondering if you can, maybe there's other tips that you have, and anybody else who's with us today.
Well, we invite our participants to share with us what advice they might have for someone in this situation, or to share anything with us. I will add that I also recommended that my colleague and her husband go for couples counseling. just briefly to help them get through this and to get through it in a united way. I think one of the issues for my colleague was that she felt that her and her husband had come to an agreement, and now he was backpedaling on a commitment. And that was a source of a lot of conflict for them. I've talked with her a lot and helped to explain, as we know, the circumstances of caregiving are never the same. They're always changing. And so things that we might have signed on for earlier on are not necessarily what works at a later point in time as someone's health circumstances deteriorate. So I will share a little good news that has come from this is that she did take her mom to the doctor. There was a change in medication, and her mother is much more, I won't say sedated, but she's more at ease. She's not feeling as aggressive and hostile and lashing out. So there was a medical remedy, but I think it also carries to circumstances within the family. And it's been helpful for them to talk about this with their son as well. I do see, Latanya said, very well said, Elliot, things don't always turn out like the way we think. Well, it's very true.
Well, it's for sure. It's that journey you go on. I mean, things in the beginning of being a caregiver for my mother were different. She was able to do a lot more as the disease progressed. She was able to do less, so it had to be adjusted. Personality changes, all these things. So it's never, that's what makes it so difficult at many times, because you think you've got it under control, it's working, and all of a sudden, poof, the disease progresses and things change.
And that's why our mental health is so important, because if we have a good baseline, we can handle anything. So I hope that a lot of the things that we've talked about today are of value and meaning to our participants and to those who view this recording at a later time as well. I will open it up again for more questions, discussion, but I want to make sure that I post our resources slide here, because we have the resources that we spoke of today, the Crisis 988 Lifeline that I talked about, and also the National Alliance on Mental Illness has a service where you can text them. And that number is 741-741. You can text them anytime if you're in a crisis as well, which some people are more comfortable with. And then we also have the National Domestic Violence Hotline, which is at 1-800-799-7233. They also have a text service, and that number is 22522. The reason that we provide all these hotlines, as I said earlier, a lot of people feel a little bit apprehensive about entering into counseling. I love the idea of a hotline as a first stop. You can give it a try, see how you feel about it. And again, it's free, it's anonymous, it's confidential, and it's not something you have to commit to, which I think is important for certain caregivers, depending on circumstances. And thank you so much for posting the registration link for next week. It's also hyperlinked here in my yellow highlights. So when you get a copy of our handouts, if you just click on anything that you see here that's highlighted, you will be able to register for our program next week as well. So I wanted to see if anyone has any last questions or comments or anything that they would like to share.
This is Joanne. I just want to thank you. This is very helpful. I work with caregivers as a volunteer all the time, and a lot of these resources are going to be very helpful. And just got a call yesterday about someone that was using substance abuse after the death of her husband, well, alcohol. And when she was calling people drunk, she was saying she didn't want to live, that kind of thing. So I'm like, oh yeah, I'm going to call them and tell them 988, they need to call, and the friends need to get on top of that. So it was a good reminder. Thank you for that.
Of course. And what you just described is so common.
Yeah.
Unfortunately, a lot of older adults are turning to alcohol, to marijuana, and we have to remember that these substances are depressants, specifically alcohol. So they will not make anything better by any means. And unfortunately, as a society, we're accustomed to turning to things that really aren't going to help us. And that is exactly the purpose of this whole series this month, which is how do we promote our health and our well-being for caregivers?
Great. Thank you.
Joanne.
Yeah, thank you.
Thank you for sharing that.
All right. Well, if anyone else has any questions or comments, feel free. In the meantime, we'll pass the torch over to Glenda to share some upcoming news about programs.
Great. When you do receive the PowerPoint presentation, in a few days, there'll also be a survey there for you. So we'd love to get your feedback on how we've done today. And I always tell people, if you have a topic that you would like us to cover, please put that in that feedback. We'd love to do the research on it and find a speaker, if it's not Elliot and Lucy, to take care of that for you. The other thing I wanted to share as a personal comment is the one thing I've learned over time being on the Caregiver Teleconnection is how fluid caregiving is. And y'all were talking about that, and what happens today is not a predictor of what will happen tomorrow. So as Elliot said, next week on October the 25th, we'll be back with you at 10 o'clock Central Time talking about stress management. You've got the links there to register, and we hope you'll join us next week. Tomorrow, I'll be back with you with Dr. Natalie Oliver. If you haven't heard her before, I certainly encourage you to join us tomorrow, and that's at noon Central Time, so during your lunch hour. She's going to be talking about saying goodbye to someone with dementia. So a very tough subject, but one that we need to talk about. And then on Friday, once again, I'll be back with you at 11 o'clock Central Time, and we're going to be talking with Cynthia Hazel. She's going to be talking about combating compassion fatigue, is what we've kind of oh, there that puppy is. Talking about compassion fatigue and stress management, puppies can do that for you. They can take care of that. So thank you for sharing that. We're so glad that you joined us today. Anybody else have a question, comment? Oh, yes, upcoming Caregiver Summit. And here's the link for that also. So Tina is sharing all kinds of good information with us on November the 9th. Oh, that's right around the corner. Be sure and look at that information also. Because I think, Tina, you can do that virtually. Is that correct?
Yes, yeah, that's correct. We're actually going to have a hybrid option, so we'll mainly be online, but we'll have some kind of what we call watch parties, some places where people can join us in person in different places around Texas and a couple spots in Florida as well, but certainly virtual. Also on that link, you'll see, so November 9th is a summit, and then the following week on Thursday, the 16th, is a Spanish Caregiver Summit. It'll be different speakers, but same kind of theme as balancing your journey, or finding balance in your journey is the theme this year.
Important topic, really important topic. So I really encourage you to look at that link and look at what's going to be presented on November the 9th virtually. If you're not in Texas, if you're in Texas, there'll be watch parties and in Florida. So take advantage of it. Well, okay, at this point, having nothing else to share with you from my point of view, I'm going to go ahead and stop the recording and leave the meeting, and you can remain on the line with Lucy and Elliot to have a private conversation.
And the support puppy.
And the support puppy. Oh, so cute. So thank you for joining us today, and I hope to see you in future sessions.
Thank you, Glenda, so much.
You're welcome.
So much, Glenda.
All righty. So stop the recording.
I think we're going to take a 2-minute break if anybody needs to go to the bathroom.